Well, thank you so much for having me. Again, I am Dr. Stacy Scott. I work with the National Action Partnership to promote safe sleep, improvement, and innovation network. And I'm going to speak to you today about our journey in working to make breastfeeding and safe sleep a national norm. I first want to begin by giving you what our objectives are for this particular session. And number one is to analyze the journey and incorporating perspectives from both breastfeeding and safe sleep communities in working to combine messaging. And then our second objective is discuss the redirection of efforts in recruiting partners with diverse backgrounds to achieve equity in safe sleep and breastfeeding rates. And so I want to just give you a little bit of background about NICHQ, which is the National Institute for Child Health Quality, who actually has the cooperative agreement with HRSA that actually created NAPPS. And so NICHQ is a mission-driven nonprofit dedicated to driving dramatic and sustainable improvements in the complex issues facing children's health. And of course, that big long name that I mentioned earlier, which we refer to as NAPPSS-IN. And NAPPSS-IN is working really to make infant safe sleep and breastfeeding a national norm by aligning stakeholders to test safety bundles in multiple care settings and to improve the likelihood that infant caregivers and families receive consistent evidence-based instruction about safe sleep and breastfeeding. So as we start out, I want to pose this question to you all, and just thinking about what the journey we've traveled in working to meet our goal. How does one begin the work of incorporating perspectives from breastfeeding and safe sleep communities in working to deliver a combined message? Well, I can say it's not an easy task. We are coming from two different frameworks around safe sleep and breastfeeding. And as I keep referring to it, has been a journey, but it's been a good journey. And we are definitely making progress as we move toward being able to incorporate messaging. So the key steps to combating this message, what we've seen in the work that I've done with NAPPS, is number one, to align the stakeholders, number two, to agree on a common goal, and three, to develop a strategy. So if I was going to ask you, what do you think, or what do you think I mean when I talk about aligned stakeholders, I'm interested in what your answer would be. But let me let you know what we're doing and what we've done. And so NAPPS is a multi-level, multi-structural project. And so with that, we have several stakeholders, which would probably be very similar to who you might be working with in your community. However, ours is from a national perspective. And so we really are looking to activate, and we did activate Safe Infant Sleep and Breastfeeding Champions. And I just kind of give you an overview of how that hall came to be. So we have like 4 levels: the National Coalition, Expert Advisory Committee, Wisdom Council, and Communities of Practice that are due to begin in January 2021. And so I'm going to give you a little bit more information about that later on in the presentation about each one of those groups. We also work to engage national action teams to drive measurable change in increasing the adoption of safe infant sleep behaviors and breastfeeding. And we bundled care, really, people refer to them as safety bundles. And this was really, again, looking at a multidisciplinary sites. And we, in the beginning, are working with hospitals to drive change toward meeting our aim. And again, of course, the aim is making breastfeeding and safe sleep a national norm. So In the project, we have cohort A, which are hospitals. There were 5. In cohort B, again, looking at a prenatal perspective. And let me go back. Cohort A was from a postnatal perspective. And when we looked at cohort B, not only did we work with hospitals, we also included prenatal partners. And cohort C, which is due to start in 2020, will be post-discharge, hospitals as well, along with community partners. And again, I'll give you a little bit more information about that. So when we talk about agree on a common goal, I'm quite sure many of you out there have had the opportunity to bring people together, especially in the public health arena, around how can we work together as a collaborative, what brings us all to the table. And so that's what we looked at. We took a look, and we wanted to know what ultimately a common goal was. I'm quite sure for many of you in work in this arena, as for us, it was really about making sure that babies were safe first and foremost. But looking at it from the NAPPSS-IN purpose, based on our cooperative agreement, as you'll get tired of hearing me say this all the time, making safe sleep and breastfeeding a national norm. And so these particular goals and objectives were really set by HRSA within the cooperative agreement, when it really was to design a positive influence, and really look at such things as always placing babies to sleep on their backs in a safe environment, which is we're following the Academy of Pediatrics recommendations. Of course, ever breastfed, and 3, to continue breastfeeding for 6 months. Ultimately, the program seeks to reduce the rate of infants who died tragically due to sudden, unexpected infant deaths, which we refer to as SUID deaths. So, developing a strategy. Again, just going back to you all and thinking about that, I want you to take an opportunity to think about when you're looking at collaboratives, what are some key things that you look at as you begin to develop the strategies once you have determined what your aim and your goal and objectives are. And so what we did is, again, our strategy, going back to what I said earlier, was to incorporate all of our champions, to engage the National Coalition, the Expert Advisory Committee, Wisdom Council, National Action Teams, soon to be communities of practice, and really look at our hospitals, our prenatal sites, and our community cohorts. So when you look at a national coalition, our members incorporate national organizations such as the American Academy of Pediatrics, and other organizations that really look at keeping babies, infants, children safe from a national perspective. And the members of the National Coalition really are key to our project. They look at implementing what the National Action Plan was that had been established prior to NICHQ receiving the cooperative agreement for NAPPSS. It looks at assisting states in integrating safe sleep and breastfeeding promotion efforts. We're working to engage families in a respective dialogue, really helping families to overcome barriers and how they can integrate both safe sleep and breastfeeding. And also, of course, providing resources to help get that message across. Also, looking at promoting safe infant sleep and breastfeeding, NAPPSS safety bundles, again, which were implemented by hospitals and childcare and social service settings. So we rely heavily on the National Coalition membership to really kind of be our guide on, and also our resource for us overall to kind of hear, what's going on out there in our national community. And I would suggest at any time that you all are looking to do this, locally, it is paramount that you find these key partners that are out there doing the work, and being able to engage with them in a conversation and being able to hear and learn from them on what they're doing and what they've experienced and what's working and not working. Our next group was the Expert Advisory Committee. And this committee, as we call it, the EAC, was really to provide leadership and expertise and strategic direction. And this was a small group of people that we brought on for their level of expertise, and really kind of was our listening ear as we began to set the agenda for the National Coalition, being able to create linkages between the community and the council members, and really helping us to overall implementation to the NAPPSS-IN project as a whole. Then we had what we call the Wisdom Council. And the Wisdom Council, again, was part of the cooperative agreement. And their purpose was to make sure that there was an equity lens over all aspects of the project. And they worked in collaboration with the Expert Advisory Committee. Also, we'll be working with the community of practices to ensure that we are being inclusive, that we're embracing diversity, that we're looking at equity, and to really look at what it takes to reduce the disparities that we see within breastfeeding and safe sleep rates. Then we have our national action teams, and these teams are really a lot of members that are from the coalition, the national coalition. There were 4 teams that were created, and as you see here on the screen, childcare and early education, public media, media relations, aligning national, state, and local efforts, testing and implementing conversation modules. And again, they meet on every other month basis. And they are the ones who are really putting out products, things that you might have seen on NICHQ's webpage under the NAPPS section, anything from some sort of resource guide or baby product registry or other things that can be used as a tool to help you all do the work you do. And we, of course, our charge was whenever they created, we wanted to make sure that the safe sleep and breastfeeding message was combined in whatever product that they produced. And so, again, our community of practice, which is due to start actually in January of 2021, will be, again, an opportunity for certain professions to come together on a quarterly basis to share best practices and resources, again, provide support to our cohorts within our hospitals, and provide direct feedback on some of the products that we have produced. So we're looking forward for that, and we will be recruiting members to join our community practice, so please stay tuned. And so again, as I said, it's a multi-level project, and sometimes it's like, oh my God, how do we keep everything going together? But we do. We have our cohorts A, B, and C, which is, again, people who are responsible for testing out our bundles, and really looking at an improvement process that hospitals can share on with their outcomes. So they do such things as room audits after the baby is born to ensure that the baby's in the room, there's nothing in the crib, the baby's on their back. They also promote breastfeeding and come up with breastfeeding plans. And so these bundles are currently being tested out all over the United States. It's really being able to see what works, what doesn't work, and how do we modify that based on delivering the messages and making sure that the caregivers are getting what they need in order to be able to follow the recommendations. So as you see, that was a big piece here. And this project's been going on for about 2.5 years. Has it always been on the right track? We want to believe it was, but you know, again, we recognize that there was some barriers and some deficits that we really had to take a look at and go, okay, what do we need to do to make sure that we are really working to achieve what we are setting out to do? And so one of the big pieces, again, when I came aboard, we took a long look of the whole diversity piece, and may I say the lack of diversity. And so we felt it was very important in looking at being able to recruit some additional partners from diverse backgrounds, really to being able to help us to achieve equity in safe sleep and breastfeeding rates. And I don't know, for many of you, as you begin to develop these coalitions and things of that nature, of equity is a big focal point. And now with all that is going on today, that we recognize that there's so many things that we have to come up against around systemic oppression and racism and all of these things that really impact our families. And so we were very concerned about if we were really reaching the right folks and if our message was correct. And so with that, we took some key steps toward equity. And so we had to step back and refocus our approach. We did some restructuring and we relined some of our deliverables. And I don't know, for many of you out there, you might be in the process of doing this. And so when we talk about refocus our approach, we recognized that we really needed to be able to do equity and an empowerment lens. And so when I talk about equity and empowerment, it's really looking at stuff with a racial and social justice sort of overview and outlook. And because NICHQ, who again holds the cooperative agreement, is a quality improvement organization, we really wanted to look at it from a quality improvement and use this as a tool to really help and improve in our planning and decision making. And we recognize also in our resource allocation, which leads to a more racial, equitable policies and programs. And so we did an inventory. And you know, again, as you move forward, and if you're looking at embracing this breastfeeding and safe sleep together, I think it's so very important that you take an inventory and be able to say, you know, what are we doing right? And what do we need to improve upon if there is some deficits out there? And so what we did is we really looked at some core questions and some principles. And in doing that, we did some reflective thinking and really began to, number one, deconstruct. And that was that question: what is not working around racial equity? And number two, reconstruct, and really begin to look at what was working, and then shifting the way we made decisions and thinking about the work that we were doing, and then working towards some healing and transforming our structures, our environment, as well as ourselves. Now, I know many of you might say, well, that's a whole lot, just thinking about breastfeeding and safe sleep, but it was crucial. I think it's so important. We can't underestimate people's lived experiences around certain things. And when we look at the sped rates in breastfeeding and some of the historical connotations around breastfeeding, especially around Black women, you would have to really understand that to be able to know, how do we address that? You know, how do we overcome some of those historical trauma that women experienced around the whole subject matter of breastfeeding? And then also, what are some of the ramifications when we say to people, babies should sleep in their own crib, on their back, you know, don't bring the baby to bed. So we recognize that, and it really helped us change the way we operated and worked around these subject matters. And so one of the big things that we felt we needed to do, even going all the way back to our national coalition, is we said, it's nothing like a survey, and that we really needed to hear from our partners, all of them, on exactly what they were doing around safe sleep as well as breastfeeding. And so here on the screen, you can see a survey, just 4 questions. We wanted to make it as simple and non-threatening as possible. And you could very well use these same questions as you're beginning to maybe survey some of your local partners, if this again is something that you want to look at doing. And so what we wanted to know was, you know, what was your organization doing to increase the number of infants being placed on their backs in a safe sleep environment? We also wanted to know, what were your organizations doing to make sure that infants are ever breastfed, for those continuing to at least breastfeed up to 6 months. We also wanted to know what your organization was doing to reduce the rate of infants who tragically die due to sudden unexpected infant death. And our 4th question was, what are you and your organization doing to embrace diversity and inclusion in order to achieve equity in safe sleep and breastfeeding practices? So, you know, I'd like to give you a moment just to kind of reflect on those questions, and, you know, how would your organization respond to these? And so we put that out there to our partners, our champions, and we got responses back that really helped us to begin to recognize what we needed to do around some restructuring within the whole NAPPSS-IN project. And so one of the first things we recognized that was so important is that we really needed to diversify the national coalition. We currently had about 70 plus organizations that made up the national coalition, as you see here on the screen. And these were your usual partners, your usual people who are always asked to come to the table, who work in this arena, that are very important and crucial to this work. But we also looked at the fact that we recognized that within that group, we had very limited diverse representation from the various organizations. And so we asked our Wisdom Council and other ones, could they recommend people or organizations that we could reach out to to become part of our coalition. Now, let me say, and I have to be very honest here, we've done some outreach and it's been difficult, because what is the problem? The table had already been set. The table had already been formed. And so here we come now saying we recognize the importance of you being at the table as well. And in some cases, people might accept, and in others, people might say, well, you know what? You didn't set the table with me being part of it. I don't need to be a part of it now. And I mean, that is some of the fallout that you might see. And so I want to impress upon each and one of you who are viewing this is that when you are looking at taking on some sort of aim, looking at it from a coalition standpoint, please, please identify your partners early on, make sure that when you begin to go into those first steps of coming up with a common goal, bringing on stakeholders, that you have these stakeholders there from the very beginning. It is difficult, again, to bring people to the table when the table has already been established. And, you know, people can take that sometimes as just being an afterthought. But we are committed. We continue to work. We've had increased the diversity, not to the degree in which we would like to, but we recognize our mistakes. And this is a lesson learned that now allows me to be able to say this to all of you all who are viewing this session, to understand that that is crucial in making sure that you embrace diversity and equity and inclusion early on. And so what did we do? We felt that was another big piece. A lot of times you lose your members. Originally, we met twice a year for 2 hours with our national coalition. That just was not working. So we changed that and moved that meeting to quarterly. We began to feature our national coalition memberships on our calls, on our webinars, to really hear from them. They didn't need to hear from us and hear us preaching about what a great job we were doing. We wanted to hear from them and hear from them about what their work was and how their work can work with us and with each other within the coalition to be able to move the needle and to support our overall aim. And again, that talks about more inclusive agenda, and that was it was much more inclusive than you just as your organization leading a call. It is important to get everybody involved and get everybody engaged. And so another big thing we did, and as you heard earlier, we had what we call the Wisdom Council and the Expert Advisory Committee, which were like two separate groups rather. I mean, again, the EAC was kind of our guiding group that we went to kind of help us in our decision making. But the Wisdom Council was over here that was really supposed to put things and stuff that we were doing from the equity lens and, you know, looking at it from a more equitable standpoint. So we said, okay, you know what? I think it's important that we combine the two. You know, no matter what decision we made, that we recognize again that equity was the guiding principle, so to speak, if you want to put it that way, around making sure whatever we incorporated, that we use that lens of equity and empowerment. So as what we did, we changed the name of the group and we combined them, and they actually became the Wisdom Advisory Committee. And the purpose of this committee was to provide leadership, expertise, strategic direction, using an equity lens and the development of culturally component approaches and resources in support of NAPPSS-IN project. And so since the first of the year, they'll be meeting again on a quarterly basis. And it's just been a very good process to have that together. So, you know, I guess for many, and the question I ask you all, when you set up advisory committees, do you separate them out as far as if you're looking at this is diverse and equity, or are you looking at it that, you know what, everybody, again, I'm gonna keep using that table, should be at the table together, and they should be at the table together from the beginning. And so again, another lesson well learned that I then want to share with you is that it's important. I think that we get into this diversity and we want, you know, we want to make sure that we have all the voices there, but why can't they be part of leadership or part of the executive advisory committee? Why do they have to be separate? I think it's important for everyone to see and important for your project, for everyone to be together. And then as we went on to, after doing all of these changes and getting everybody together and doing all our surveys and getting this information from all of the different components of the project, what do? We realigned our deliverables. And again, what we have done for our 2020 objective was again to increase the improvement of our action team's evaluation and data collection for 2020. We have realized our action teams to improve communication and increase productivity. And we developed tools and process to allow staff and action team co-chairs to take a more active role in driving tasks and achieving goals. And so this goes back to our action teams, the 4 that I mentioned earlier. We, again, took a long look at them. They were meeting on a monthly basis. It's all volunteer. We had co-chairs for each, 2 co-chairs for each action team. And, you know, it's difficult to work another full-time job and to head up an action team. And so we decided that it was best that maybe we would move those meetings to every other month, and that the staff would take a more active role in supporting the action team co-chairs and the teams, and really helping them in the development and tools and processes without just totally relying on the team to do that on their own. It has made the world of difference, I have to say. The teams have been producing some great things. Please look forward to the fall. We are producing a lot of great items. Each team is being charged with doing different things that will be available for the public. And as we move into our cohort C, which is due to start in November of 2020, which will embrace the community and post-discharge, a lot of the things that these teams are creating will be there to support those organizations come November. And so again, as we said, our guiding principles, as we looked at in our redirection for 2020, was still make breastfeeding and safe sleep a national norm, and to address diversity and inclusion to achieve equity. And that is the charge for each one of the teams. All of the products that we produce have to follow these 2 guiding principles. And with that, we have really, again, like I said, brought in staff, consultants that helps to facilitate the agenda, help meeting the developing deliverables. We also included NICHQ's data applied research and evaluation team, which we refer to as DARE, that are also more involved in the action teams and making sure that we collect the data to be able to show the changes that are being made, as well as what is working, what needs, again, some improvement overall. But it has become a much stronger team working in conjunction with the volunteers and the staff, really showing our commitment and our efforts to, again, achieve our aim. And so we had the action teams now are in the process. We got all kind of surveys going on. So we had the National Coalition Survey, and then we have now the National Action Team Engagement Survey, that we are hearing from them about the changes that we made. Were they good changes? You know, what do we still need to do to improve upon? Because I think it's crucial to be able to hear the voices of all of the people who are part of this project. And so I would say that to you all, as you, again, just kind of reflect on some of the things that you might be doing internally within your agency. And if you are working with volunteers and other community partners, it is so important to not only just hear, but to listen a lot of times they have the solutions on things that we're just trying to figure out if you just take a moment to ask them. And so, I don't know how many of you might have been involved in that, but it's just good. And it's good documentation. It's something that you have that you can be able to share with your funders. It's also with the community, which I think is very important. And so again, we did the same thing. As I said, our action teams meet on a bi-monthly basis. We have our co-chairs that meet on the other off months with all of the staff. So this is just a slide that kind of reflects what I had spoke about earlier. And again, for our cohort side of the house, we will have them launch in November. We will ask each team to complete one deliverable that will support working, for example, an environmental scan, which again, we are really trying to find out in the communities where the hospitals reside within our cohorts A and B. We are going to be recruiting community organizations to come to be a part of our cohort C. So we are going to be doing some environmental scans to see, again, what's out there in those communities around breastfeeding and safe sleep. Really looking at developing some sort of assessment tools, or utilizing some of the assessment tools that are already out there that talk about safe sleep and breastfeeding. So this, again, deliverable could be a continuation of our current work, and really also looking in the opportunity to create some new products as well. So, what do you want to accomplish? Again, the question, are you all are ready to be able to say, how can you put breastfeeding and safe sleep together in a combined message? And again, as I say, there are a lot of different schools of thought. I know we run into the whole bed sharing conversation and things of that nature. But you know what? There's nothing that you cannot work out. And that's what we recognize too, is that you all have to, somebody has to be willing to be able to bring everybody together and say, you know what? It's not about us. It's about the babies. It's about the parents. We want to make sure that our message is consistent and not hearing one thing from one person and one thing from another. It is hard enough to parent. It's hard to parent a newborn. And so we need to come together as one and make sure that if we can at least agree to disagree on how we can best deliver the messages that need to be delivered to support our moms, our dads, and their families. And so just as I work to close, I want to give you some little tidbits of what our teams are working on, and that what you can look for on NICHQ's webpage. Our early care and education, they have finalized their caregiver frequently asked questions and infographic. They're working on now a document for common myths and facts, a resource for community workers and caregivers. Our public media team is developing a baby register product guide. Our conversation modules are reviewing the conversation modules for use by birth workers, home visitors, grassroots community organizations, and safe sleep and breastfeeding advocates. And these conversation modules actually reside within the Georgetown University website. They were the first group that held the NAPPS cooperative agreement before NICHQ received it a couple of years ago. So those are great resources, and we're going to create a document that can help guide people to what modules that might be best for them in their profession. We also have an alignment team looking at alignment, our national, state, and local efforts. And right now they are really working on a survey to engage our national coalition members to really develop a nice resource guide to be shared with what the type of things that they're doing, what products they have available, whether they have state or local offices, and what kind of resources that they might be able to provide to you within your organizations. So look toward about November. Our plan is to have all of these things completed. And so just stay tuned. You can always go to NICHQ and get on our mailing list with our newsletter. And that will, again, you can see when these products are completed and ready for distribution. And so with that, our work continues. And we look forward to hearing from each and every one of you. We want to invite you to become part of our community of practice. We are just an email away, and our charge for this upcoming next two and a half years of remaining of our cooperative agreement is to move beyond our own agendas, to embrace the concept of community of systems, to determine how we can collaboratively tackle our implicit bias, to address structural inequality, and to think of health equity not only as a process, but as an outcome. And what we are doing and where are we trying to get? And that's the question I want to leave from you all as you view this. The question you go back and take to your agencies. What are we doing? And where are we trying to get? I think if you ask yourself that question, that can lead to a lot of different responses that can really help guide the work that each of you all do. And so with that, I'd like to say those who do not learn history are doomed to repeat it. And so we've learned a lot within our couple of years in regards to the work that drives NAPPSS-IN. And, you know, we hope that this is lessons learned and we can document it, that we can again be able to share with each of you the things that we've been through. And again, provide some lessons learned that maybe you don't have to repeat the same mistakes that we've made along the way, but also be able to see the process, because it's always about the process on how best to get our end results. And so with that, I want to thank you. Everybody have a great week and take care. Thank you.